Hello, welcome back. This week we're talking about substance abuse disorder and how you can tell if you or someone you love has a substance use disorder. Alcohol, tobacco, and other drugs can affect adults, young, old, employed, unemployed, teachers, students, even parents. And so it's very important that we are able to recognize symptoms that could be an indicator of a substance use disorder. One of the most common things that most people notice up front is that the person will have spent a lot of time thinking about how they're going to get, how they're going to acquire, or the next time that they're going to use the substance. And so a lot of mental energy is used in the next drink or the next puff or smoke. Another symptom is that they take more than they planned to take. And so this usually happens with alcohol. You say, I'm only going to have one drink, and you end up in the next morning with no idea how many drinks you took because you blacked out. Another symptom is that there is a feeling that you can't cut down on that substance. You can't decrease the amount that you're taking. And also the idea that you continue taking the substance, you continue smoking, drinking, puffing, regardless of all the problems that you get in your work, at your school, or even in your relationships. It becomes the most important thing. There are no interests or no hobbies. Activities that you used to like to do, you don't do them anymore because you're more preoccupied in substance. A dangerous sign is that they become very secretive, very isolated, very depressed, and very defensive about their use of that substance. Mostly there's a lot of conflict due to mood. There's sudden changes in mood. So all of a sudden they're very angry, very sad, very irritable because of the substance. Another sign is that there are changes to sleep, changes to appetite, and changes to hygiene. And so this is the person who would rather drink than eat food or would rather inject than shower. And lastly, and also a very dangerous sign is that the person feels like they need more of that substance. They need more drinks to feel it. These are the people who are like, oh, one drink won't do anything to me. I would need 3 or 4 or even 10 before I start feeling it. So how can you tell by looking at someone? What are the physical signs that you can use to suspect substance use disorder? Well, the first one is red or bloodshot eyes and a change to the size of the pupil, the black part of one's eye. And so they can be very big or very, very small, depending on the substance that the person is using. And so there's a decrease in coordination. So we have a lot of accidents, a lot of unexplained injuries. Either people wake up with a broken hip or with bruises all over their body from falling, or even with concussions due to falling on their head because of the substance. Another obvious sign is shaking. We get the tremors with a lot of people, especially with withdrawal, where they'll get the shakes, which is due to the substance that they're using. You can also get weight gain or weight loss, a lot of stomach pain or headaches. So what do you do when you find someone you love is missing school or work or interactions, is having financial problems, is having difficulty concentrating, is having a lot of conflict with loved ones, there's an increase in risky behavior such as gambling or promiscuity? What do you do when you suspect that someone you love has a substance use disorder?